Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to Mental Health Matters. I'm your host, Julie Van Hardingsveld. In today's episode, we'll explore two important mental health topics that touch the lives of many. First, we'll explore the profound impact of caregivers, caring for a loved one who are on a mental health journey. Then we'll uncover the vital role that understanding, effective communication, and self-care play in this process. Later, our focus will shift to the innovative world of dementia care. We'll spotlight the Advancement for Dementia Care Centre, a groundbreaking collaboration between Ontario Tech University and Ontario Shore Centre for Mental Health Sciences. This partnership is reshaping the landscape of dementia care in Canada and offers a beacon of hope to individuals and families navigating this challenging journey. I would like to welcome our guests here today. Welcome to you both. To get started, Elaine, would you share a little bit about, if you would just share your name, your title, what it is you do at Ontario Shores?
My name is Elaine Miller. I'm the Patient and Family Engagement Leader at the hospital. I'm also the coordinator of the Family Resource Center. I also have experience as a family caregiver for my mom, who had Alzheimer's disease. Good to be here.
Thank you. We're very happy to have you. Shabnam, welcome. If you would just share what your full name is and how have you become connected with Ontario Shores?
Okay, sure. My full name is Shabnam Sukhdev. I'm here in the capacity of a family caregiver, and that's how I met Elaine. And I'm on the patient and family advisory, and I'm very happy to be able to contribute in that capacity.
Excellent, thank you. Elaine, Shabnam mentions that she's part of the Patient and Family Advisory. What is that, and how does it support the decisions and functions of Ontario Shores?
Well, it's a group of people with lived experience. We call them Patient and Family Advisors. They have either patient experience or family experience, sometimes both. And they are involved in quality improvement projects at the hospital. So, and they also have their own community of practice as well.
Excellent. You had mentioned that in addition to your professional capacity at Ontario Shores, that you also have lived experience as someone providing care to someone who needs it. What are some common challenges that caregivers face when supporting a loved one?
Mm-hmm. Well, the first thing that comes to mind is the danger of burnout and fatigue. Family caregivers are under a lot of stress, and they often are challenged to cope with unpredictability, trying to get through the system. So burnout is a definite risk. Their own mental health can sometimes be also challenged, and we know that a lot of caregivers are also experiencing anxiety and depression. There's a lot of guilt that family caregivers will often feel about what they haven't done or what they have done and how they feel they may have contributed to the situation. And we have to alleviate that guilt. And finally, just navigating is a huge challenge through the system. And we hear so often of families who are in and out. There's that revolving door kind of syndrome of trying to get help for their loved one. It can be just so grueling, and just to try and get that help, with the Mental Health Act and the way things are organized. So lots of challenges for them.
You also referenced Family Resource Center. Is that a resource that anybody can access to help navigate or educate themselves on how to navigate or best navigate the system?
Yes, and we are very proud of the fact that you don't have to necessarily have a loved one at the hospital or be connected to the hospital programs here to get help from the Family Resource Center. You can be anybody who is supporting someone with a mental health condition. I don't know if you want me to get into the programming at this point,
Sure.
but we have a distribution, like an email distribution list, so that, you can learn about programs and be notified about things that we're doing, different events and different educational like courses that we offer. We have a few things. We have a Thursday night drop-in on Zoom, and you don't have to be close by. You can connect with us on Zoom. Thursday evenings, it's informal. We also have more formalized trainings. We have the NAMI, the National Alliance on Mental Illness Family to Family program, which is an 8-week program. Also virtual. We have Powerful Tools for Caregivers, which is a 6-week program. And we also do webinars with CMHA Durham and Durham Mental Health Services on a monthly basis.
And all of these services and resources are available regardless of whether or not someone has their loved one being
Yes.
cared for by Ontario
That's
Shores.
correct.
That's excellent.
We have people from all over.
And if someone wanted to connect into one of those resources, what is the best way for them to do that?
Yep. So they can call us at the hospital, 905-430-4055, extension 6769, or they can email us at Family Resource Center, one word, at ontarioshores.ca.
Excellent. Thank you for sharing that. Shabnam, as someone who has been a caregiver, your perspective is so invaluable to this discussion today. What has been the most significant challenge that you have faced?
I think I would just go back to the time my daughter was first diagnosed when she was 16. Denial was a very big piece, and I think the biggest struggle that I had as a parent was acceptance. So because of which I kind of shut myself out from the community, and we were very secretive. And the stigma, of course, was another very big challenge.
Of course. And again, your perspective is so valuable because I think often when we think of caregivers in the context of today, we think of perhaps taking care of an older parent. So to have your perspective of a parent who is facing a mental health challenge with their child, I think is really important and really valuable for you to share that perspective. So thank you for being vulnerable and sharing that with us. Elaine, when you've also experienced being a caregiver, when it comes to self-care, we talked about burnout, we talked about all of the other factors that one may face. How do you promote self-care, or what self-care do you recommend for someone who is providing care to a loved one?
Well, and it's very much tailored to the individual, right? But I always say, because a lot of times caregivers they say they don't have the time, right? Because they're very busy doing what they're doing as caregivers. But I always say, try to carve out some time during the day. It doesn't have to be a lot of time during the day. To just do something that gives you some joy, that will re-energize you even the slightest bit. So there's usually some point where they can do that, and we encourage them to not feel that guilt about taking that time. We also reinforce that the role that they're playing is so very important to the recovery of the person that they're supporting, but also to the family as a whole. And that's why they need to take care of themselves. So they must see it as an essential. What else do we recommend? I mean, we suggest different types of things they can do, from journaling to meditation to art to, and again, it just depends on the individual and what their interests are, but we do give them suggestions, and we do some breathing, and we do, in some of our courses, we will expose them to those things to see if there's things that they like that they haven't tried. And also we have them connect with peers. So, peer support is a really key part of their self-care, because you feel immediately not alone. Somebody understands where you're coming from, and then the experience, right? Sharing the ideas. And that's a really key part of the self-care, is that supportive environment. So.
Definitely. I think you touched on it, peer support being so critical. As Shabnam mentioned, the stigma is very real, and sometimes it's hard for people to reach out. So my question to you is, as a caregiver, someone who is facing a mental health challenge with a loved one head on, how do they overcome that stigma and make that first step in reaching out? What do you suggest?
Sure, it's been a 15-year-long journey, so it is not something that happens overnight. So I'm speaking from that perspective, and I think what would really help is building connection with the community and finding the peer support, because that is something that I did not do initially, not even ask questions. And I also believe that as a caregiver, you need to be very proactive in the care that is being offered to your loved one by the hospitals or by the doctors. And we need to reach out more and ask more questions so that we get the care that is required. And being culturally, it needs to be more culturally inclusive, I feel. And maybe somewhere I excluded myself because I thought I was a woman of color and I do not have the wherewithal to ask questions. So I think I struggled a lot with that. And I would say you need to really stand up for your loved one and be the advocate for your loved one. And I think that's why I'm here today.
And what an inspiration you are for others who may be watching today and have similar or experiencing something similar and have the same barriers. Take us back to, how did you get connected with Ontario Shores? What was that first step or first introduction?
Okay. So a couple of years ago, I started, during the pandemic, it was during the pandemic that I started making a film with my daughter. She had repeated hospitalizations, and I'm a filmmaker, so I thought that would be a way of coping with what I'm experiencing. And we started filming together as a family since we were so isolated. And this process of working together made us all accept one another in the given situation that we were finding ourselves in. So it's a pandemic, you're isolated, but you're building those connections. And I think that was the starting point for me, and also for my daughter, who now is writing her memoirs, which is going to be published soon. So it's that courage piece that we miss on. And to that point, I'd like to just read out something I read recently,
Sure.
if that's okay. All right. So it's something written by an author, poet called Guillaume Apollinaire, if I'm pronouncing him correctly. Come to the edge. Come to the edge, he said. We can't. We're afraid, they responded. Come to the edge, he said. We can't. We will fail, they responded. Come to the edge, he said. And so they came. And he pushed them. And they flew. I think what this really means is that if we are able to overcome the initial fears, the reluctance, the insecurity of not being able to deal with what your child is dealing with, I think it only gets better from that point. And I feel today I am able to look at my daughter not from the lens of her diagnosis, but more from the lens of what she's able to do. And that's a blessing, like it takes off the burden of my shoulders. And like she recently got married. So she wanted to, and I could have had those insecurities. Oh, how would it be for her? Will she be able to manage? But she's living by herself and she's managing that life. And I'm so proud of her. And having said that, she might fail. She might have those moments, you know, so
we all do.
that it is a roller coaster, right?
human.
Life is a roller coaster. So we just embrace that,
Yes.
you know?
That was my next question to you, which is, as you can see on my shirt, the word hope. It's
Yes.
really a beacon of what drives a lot of what we do here at Ontario Shores. And what you've shared about your daughter definitely inspires hope.
Yeah.
And I'm sure there were days that hope seemed very distant.
Yes.
But as you sit here with us today, it's a very real piece. And your daughter has got married, and I was actually going to bring it back and say, so she is producing a memoir. Do you want to share a little bit more about that and what she's working on?
It would be great if you have her on the show one day.
Absolutely.
She'd be very happy to be here, I can tell
Absolutely.
you. Yes, it's about her journey from as a child, you know, like she talks about how she was impacted by her parents being separated and how she had to move from home to home, you know, and she had to make choices sometimes. So she's written all about that. So she's basically exposed us, right?
Yeah.
She's exposed her parents, and that's her privilege. You know, because that's her perspective, that's her lived experience, and she has that right to write about it.
Well, we look forward to bringing her back one day and sharing maybe both of you together and how together you really inspired hope in your family.
Okay.
Thank you both for joining us today.
Thank
Elaine,
you.
thank you so much for your insights.
Pleasure.
And thank you, Shabnam, for being so vulnerable and sharing a little bit of your story.
Okay. Thank you for having us.
It's Mental Health Matters, and I'm Julie. Thank you for joining us. We'll see you next time. Welcome, Dr. Burhan, and welcome, Dr. Sen. We're so happy to have you here today. My first question is for you, Dr. Burhan. Can you outline for us the ADCC's mission and goals briefly? And perhaps, I know I covered it in the introduction, but share what the acronym ADCC stands for.
Right. Thank you very much for having us for this opportunity. So the Advancement for Dementia Care, DCC, is really a partnership between Ontario Shore and Ontario Tech. And the main really mission is to improve the quality of life of people living with dementia and their caregivers. Now, to achieve that, we are thinking of an innovative way of providing the care that we provide, and that includes leveraging technology, but also really thinking about the co-design, bringing people together to accomplish this, including those living with dementia and their caregivers, so that we don't create something that's distant from what they're living day to day. There will be other aspects, of course, listed on our website to clarify how we're going to do it. I just want to emphasize that's really about partnership, about engagement, co-design, and really innovation, so that things will be immediately visible when we provide a better care to people.
Really important work, especially given the rise in dementia diagnosis here in Canada. With that, my next question is for you, Dr. Sen. What challenges do dementia patients and their caregivers face?
Yeah, there is a multitude of challenges for persons with dementia, including physical challenges. They have, physical frailty and cognitive functioning, and it's much of the time is compromised. And oftentimes, because of that, that really affects their social functioning and relationship, and as well as a lot of times they have, other mental health problems. For example, depression, loneliness, social isolations, all of those are really impacting, impacting the multidimensional aspects of the person with dementia. But I wanted to also mention that it's not just the person with dementia who is suffering. Oftentimes, this journey is also affecting person who are looking after the person with dementia, which would be the caregivers. So the caregivers, oftentimes, they are called the second, victim of the disease. And the many of those challenges coming from, again, the physical challenges, such as looking after the patients around the clock, the lack of sleep, the sleep deprivation, and then because of that, that oftentimes would affect their socialization, and because of that, that also affects their mental health as well, such as depression, loneliness, anxiety, frustration, and the most important aspect is the financial implications. Oftentimes, caregivers, they have to give up their job, their full-time job, in order to look after the person with dementia, and that has major implications on the financial responsibilities for them. And not just that, that in itself, the financial implications can have major impacts on the health system, because when they actually withdraw from the workforce, we can't find people to work in the workforce. So that has, a major chain of reaction that, affecting many of the aspects of not just the people, but also the health system overall as well.
Yes, the implications are very far-reaching. Dr. Burhan, are you willing to share with us some of the tech-driven research stemming out of the ADCC that is improving dementia care?
Yeah, certainly. I think we've been on this journey for quite some time, although our center was officially launched last year, but we have started already quite a bit of collaboration previously. I think maybe highlighting a few things. So while we're caring for people with dementia, the current way that actually follow the evidence base, we are trying to first find better evidence. So, for example, exploring new interventions, new agents we use to help people with behavioral symptoms of dementia in our units. But while we're doing this, we're also trying to address some of the limitations we have, such as our ability to measure behavioral symptoms. So we're using wearable devices that will detect physiological changes and movements of people with dementia, so that we can tell maybe are they in a state of agitation that require care. We're also looking at artificial intelligence and deep learning to see if we can make sense of the information we're getting, because you get the movement, you get the heart rate, you get the skin temperature, and you want to make sense of it so that you can not only apply a standard approach, you want to also know what is this individual dealing with and how can we make standard approach individualized as well. Beyond that, there's also other innovative tools that we have been leveraging. For example, virtual reality. We know that a person who's confined by virtue of their dementia, unable to move in the community, may access more if they can use virtual reality. And this is work that my colleague Dr. Sun has been doing to actually bring people back to time of their life when they were actually more able to remember. So seeing pictures of the wedding of their children or something like that will actually bring a lot of pleasure and quality to their time. The other thing is, thinking about way to enhance the skills of caregivers themselves. I mean, all of us are, exposed to things in life, and unless we experience it, we can't really tell what do we need, to learn more. So there's a program called the Caregiver program that has been available for some time now through the Reitman Center in Mount Sinai, and we're now trying to adopt it to virtual space so that we can maybe increase access to it, so that people may access it without having to be physically there with other, the coaches and trainers and so on.
So much good work. I think it's really important to touch upon, and perhaps Dr. Sun, you could expand on the ADCC's role in building a dementia workforce and other notable programs.
Yeah, thank you for asking this question, because, Dr. Burhan and I, we've been working on the development of a micro-credential program in dementia care. So the reason why we did that is we wanted to ensure that people are educated about what dementia care is, and specifically people who are looking after the people with dementia. So we developed this program specifically for nurses and personal support worker in long-term care, and hopefully that program will, it will help them to develop that competencies, skills, and knowledge to better care for the people with dementia, to increase the quality of care. And that program could be applicable to caregivers or even other healthcare professionals in the future. So that is our goal of that micro-credential program.
Excellent. I know Ontario Shores has partnered with Ontario Tech to develop a large number of micro-credentials, and those are available and accessible online through Ontario Tech Talent as well as Ontario Shores website. As we wrap up the discussion today, Dr. Sun, perhaps you could expand or share with our viewers what are your hopes for dementia care and the transformative role of ADCC in the future?
Yeah, I think that, it's very important for ADCC to really continue on with that, educating the public about what dementia is all about. There's still a lot of misconception, a lot of stigma, discrimination against people with dementia. So that raising awareness is an important role for us. And then also in the development of our technological innovations, we wanted to not just develop them, but really focusing on and examining what are the impacts. What are the impacts on patient outcomes, on caregiver outcomes, and system outcomes? And ultimately, that would lead to the development of the caregiver support policy and also developing policy, to support dementia-friendly communities.
Excellent. Dr. Burhan, do you have anything to add to that?
Yeah, I think Dr. Sun have covered a lot of the really foundation of our philosophy, how to make sure that our work is impactful. I think maybe just adding that access to different type of care is limited by virtue of several factors. One of them is the fact that we have a growing need, growing population of people living with dementia and their caregivers that we know that are quite diverse themselves, younger, older, working, not working, but also that our resources continue to be strained. And technology might be a way to actually facilitate access, because if we can do the same thing with less human resources, and not saying that we want the human resources to continue to have the skills, but one person can now expand their role by having technology assisting them. And that's the same with virtual reality, for example. If somebody can access a program like the reminiscent therapy or caregiver intervention at home, that may reduce the need for these programs to continue to expand and really put more strain on our system. So access is one thing I'd like to highlight, but also advocacy and changing policy around care, because our community is not just hospital and clinic. There's actually people living, transportation, living in the community, going to your bank. I mean, all these things has to be really geared toward the need of people who are dealing with cognitive impairment.
Excellent. Thank you both for joining us on today's episode of Mental Health Matters, and thank you for your contributions to the sector and all of the work that you do.
Thank you so much.
Thank you very much.
Thank you. It's Mental Health Matters. I'm Julie. Stay tuned for our next segment. Up next is a Mental Health Minute, where Ontario Shores staff share insights, stories, and wisdom to inspire and uplift.
A quality that is really important for someone who's working in mental health care, any type of healthcare, is to want to have that drive to see the impact right in front of you. So whether that might be in a department such as mine, which is research, and seeing how the data collected might actually impact someone's care treatment plan in the future, or if you're a nurse, seeing how you interact with a patient every single day might impact them. That is so important, and that's different than what you might see in another sector where you might be contributing to the big picture. Here, you're actually able to see the direct impact of the work you do every single day.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.